I'm Dr. Cynthia Chapman. I'm the acting director at Fort Belknap Hospital, and I've been here for 16 years. So I'd like to talk about some major protective factors of suicide. One of the most important ones, I believe, is the connectedness to individuals, having strong attachments and from early on. Also connectedness to the community, to family, to friends, to institutions or social activities. That connectedness is very important. Also, individuals knowing how to solve problems. Suicide, of course, is a permanent solution to a temporary problem.
Hi, I'm Dr. Paula Epperson. I'm with Behavioral Health at Indian Health Services, and I'm here to talk with you today about some warning signs of suicide and some warning signs about depression. First of all, I've been here over 21 years, and we don't want anybody to kill themselves. Life is important, life is sacred. Please get help. Some warning signs of suicide are talk about wanting to die or wanting to kill yourself. Looking for a way to kill yourself, such as by searching online for methods or buying a gun. Talking about feeling hopeless and having no reason to live, feeling trapped or in unbearable pain. Talking about being a burden to others. More use of alcohol or drugs. Feeling anxious, agitated, or engaging in reckless behavior. Sleeping too little or too much. Withdrawing or feeling isolated, showing rage or talking about seeking revenge, having extreme mood swings.
And learning how to solve problems and difficult problems is particularly important. I think another factor too is individuals learning how to handle strong feelings and deep feelings and painful feelings, learning how to tolerate that and learning how to get through it. It doesn't last forever. Going to other people to talk with them about your feelings and having them help you connect and to solve those problems.
Teenagers, similar information. Sometimes teenagers are more impulsive, so it's important for parents to realize that they have less coping abilities than adults do. They're also dealing more with rejection, failure, breakups, family turmoil. Okay. Remember that suicide is a permanent response, not a solution to a temporary problem. Everybody's moods change quickly. You can feel happy 1 minute, laughing with friends 1 minute. You might feel sad about a loss the next minute. You may feel anxious about a test the next minute.
Also, protective factors are not all the same. They're not equivalent. That's why I go back to say that attachments are probably the most important. And breakups then can be a very significant risk factor. Also, knowing the risk factors is important for individuals to protect them from thinking about suicide, acting on it, or planning it and rehearsing it.
Good afternoon. We are the Fort Belknap Tribal Health Empowering Inner Strength Program.
Umbo Washday. Name's Hannah Hazigold, and I work in the Mountain Lodgepole District for the EIS, Empower and Inner Strength. And I also cover the Dotson area. And my number is 406-399-0140. And we work for the suicide program.
My name is Tanya Doney. I'm an agency advocate for Empowering Inner Strength. My phone number is 399-0242.
We are located in 4 districts. Dr. Foster is our clinical psychologist, and he is located at the Fort Belknap Tribal Health Department. Myself, Tesha Hawley, as a counselor, and Darlene Azure as a counselor, and we can be reached at 406-353-2525. We also have Edward Buster Moore Jr., who is located at the Hayes District Office, and he can be contacted at 406-399-0456.
Personal protective factors, those would be things like positive attitudes, values, having social skills, having hope for the future. Sobriety also is an important factor. Having impulse control, those are more internal factors that one has to develop and learn to do. And you can. I mean, children can learn that at their developmental stage, and also adults. And that's part of what therapy is helping people to look at themselves, talk about it, sort it out, and internalize it so that they can act on things differently or act on difficult things differently instead of destructively. When I see individuals in the emergency room, and these are individuals who have come to the emergency room that may have thoughts about killing themselves, they may have planned to do something, or they might have even acted on it. In talking with them, I always ask them, what do they think death is? And the spiritual aspect to death is important to raise and for people to talk about or to think about. It's one of the reasons we've asked some of the spiritual leaders here to talk about suicide. When individuals have the notion that there is no other existence but this one, they're more likely to take the risk of killing themselves. Because they want to get out of the pain, and they think if there's nothing, there's no more pain. If there's no more me, there's no more pain. I think one of the critical factors in preventing someone from acting on those thoughts is what has prevented them from doing that in the past if they have had those thoughts. Sometimes it is spontaneous or it's very impulsive, but a lot of times suicide is kind of a gradual increase of looking more likely. And so when we ask people what has prevented them from acting on those thoughts, it's often, I don't want to do that to my children. I don't want to hurt my parents. I don't want to hurt my best friend. I don't want to wound the community even. So those are some of the more critical factors, I think, that really help people not to act on those thoughts. And it isn't unusual for people to have those thoughts. Many people do, but trying to interrupt those and to look at life with some hope and opportunity is really important.